I'm here at HIC 2025 in Melbourne, hosted by the Australasian Institute of Digital Health. Here at the event, here in the Digital Health Studio, we're having conversations about interoperability, cybersecurity, artificial intelligence, femtech, and so much more. In this special feature episode of the Talking HealthTech podcast, you'll hear some of those discussions that we recorded during the event. You can catch all of those discussions in a special feature podcast that we'll be showcasing there. Collaboration starts with a conversation, Team HealthTech. Let's make it happen.
So my name's Rafiah Ansari. I am a clinician by background, so I'm a speech pathologist. I started practicing 20 years ago this year. Predominantly worked with the National Health Service in the UK. So I grew up there, I trained there, I worked there. And my clinical area is paediatrics, children with neurodevelopmental disorders, so autism, ADHD. And I've worked with GPs, paediatricians, physios, worked in education. So my background is very clinical, is very multidisciplinary. And about 10 years ago, gradually kind of entered into the digital health space. Very interested, after 10 years of doing the clinical side, in transformation and how we can do things better and what's out there. And that's really where I've been professionally involved as a digital health specialist. So most recently I worked as a Chief Clinical Information Officer, so overseeing all aspects of the wonderful world of digital from a clinical angle. And I think being an AHP really helped because I've engaged with doctors, but I've also engaged with healthcare providers that are more community-based and also social services and education. And I think that's the lens that I've really leaned into. And my specific area where I've really learned a lot and given a lot back is clinical governance. And this aspect of, we've got old school governance, we've got our guidelines, we've got legislation, policies that have been around for a while, and then you get small incremental changes. But that doesn't work with digital, you know? And so my role has very much been looking at the governance and the ethics and how do we bring those together. And alongside the clinical side and the digital health side, I've been really focused on the research side as well. And to me, ethics in research is right at the forefront. Yes. If you can't show your ethics, you don't get your funding, you don't get access to the patients. There's so little you can do. How can we learn from that? Not to say replicate that, but how can we learn from that to have that ethical context in health, digital health, which is changing so fast? And so how do you bring all those bits together? And I'd say that's kind of my day job of trying to work all those bits out. Yeah.
And so, I mean, all of that those tough topics and the blending the clinical governance with the innovation and the ethics of the research and all of that's going to be front of mind with attendees here at HIC generally. So I assume that kind of message will resonate. And so you're up on a stage sharing some of these insights. Is that right? Tell me about that.
Yeah. So I'm speaking regarding global health. So trying to give a summary in 15 minutes. The nice thing is, I think the National Health Service is relatively well known globally as a public funded model, free at the point of access, a universal model. There's a lot of similarities with Australia from that regard. So I think there's good foundation of that similarity. And then just sharing some of the specifics. So thinking about the frameworks we've been using, how that's worked. Clinical safety is a big aspect, and particularly from a clinical background. In the UK, the clinician drives that process. And it's unique and it's iterative and we're learning from it, so it's not perfect. But that sense of the clinician really working with the technical experts, the program managers, the suppliers to get these things through. And I really want to share that angle because I think anyone in the room hopefully can take something from that. They're either clinicians or they're here because they're interested in digital health. So that health aspect is what's driving the clinical safety of the introduction of products. And without that, you don't get the green light. So it's a good angle, I hope.
Yeah, no, 100%. I mean, that's the kind of alignment that's required to get some of these ideas and best intentions over the line and into the hands of those that need it most. Lastly, I guess on that topic, often, and I'm going to imagine based on your experience and the areas that you've worked that you would see this often, is that so much of the hype and interest and perhaps funding for innovative solutions in healthcare can sometimes miss the areas that need it the most, and that may be various factors that and incentives. But how have you found that kind of the desire to actually bring healthcare innovation to areas that they need it most? How do we get it away from just the nice to have into communities of need?
Yeah, and it's that bottom-up, top-down approach. And I think having been that clinician, but also having been involved as a researcher and working on how do we translate that back into practice. And I've also worked nationally, and I think there's absolutely a divide. And I think that it's about, like most things, communication. It's about having those clinical voices involved in the conversation and giving that clinician the time and the space to be able to give that voice, and understanding that actually their priority might simply be better Wi-Fi, quicker access, finding that letter that they know is there but they can't get in touch with, and then reading about the AI and all the amazing and wonderful things they can do, thinking, great, really interested in that, but right now I need to get my clinic sorted. But also flipping it and giving that clinician that understanding of they can drive this, and this is now part of their professional practice. It's not a nice to have. It is part of to deliver the best possible care. If there are tools there that can help, it's their responsibility to also be aware, which isn't easy because we're all so stretched. So I think conversations, communications, having the right people in the room, but changing those voices and keeping updating. It's messy and it's hard, but it's got to be done.
My name is Ramya. My full name is Dr Ramya Raman. I'm a GP, and I'm a Perth-based GP, so I'm here from the Wild West in lovely Victoria this morning, where the sun is shining, which is really nice. Yeah. So I'm a practice owner in Perth, and I'm also doing some academic work, so I teach a lot of medical students. My special interests in general practice is women's health, and that's probably what's brought me here today.
I'm looking forward to this afternoon, Ramya. We're on a panel together. I was going to ask, what are you speaking about here at HIC? But I'll be up on stage with you. Tell me a little bit more about that session that we're doing this afternoon and what you feel like you'll be bringing to that.
Sure. No worries. So, as I'd mentioned, as a GP, I do a lot of work specifically relating to women's health. So I've got a lot of women from culturally and linguistically diverse backgrounds who I look after, as well as Aboriginal and Torres Strait Islander patients. Now, it doesn't mean that I don't see other patients. I'm a generalist, so I do see all patients. But the reason that I guess I'm here today is primarily because of the work that I'm doing in my clinical practice. It often shows that women don't tend to present with the very typical symptoms as described in textbooks with certain conditions, whether it be cardiovascular disease, women's health concerns, including menopause, pubertal changes, pregnancy, fertility-related concerns, or some of the chronic conditions such as like respiratory conditions like asthma or even, sort of joint conditions like osteoarthritis. And the reason for that is because with medical science, as it's evolved over a period of time, majority of the research and the data is actually based on primarily a certain population of patients. So it's based on Caucasian patients, and invariably not a lot of women have been included in the past. I'm not talking about now. In the past, haven't been included in those data sets as much. So when collecting these sorts of information, it's often skewed and probably not representative. So there is a sort of an underlying bias in that data set. So I'm actually here to talk on the panel in relation to that and what it means to a patient who is sitting in front of you and what it means to the lives of women today. Now, certainly research and data has changed a lot. So these have been identified as sort of holes or gaps, and they're starting to be addressed. But we have a fair way to go, and one of those addressing factors have been the movement of femtech.
And so, we're doing a panel discussion this afternoon in the plenary around femtech. I find, it's great to have that conversation at an event. Sometimes we run the risk at events of doing like the obligatory femtech panel and then we go, I agree.
Yes.
And then we kind of go back to doing like what we were doing. What would you hope people take away from our session that we're doing this afternoon and hopefully progress the agenda a little bit?
Yeah, absolutely. Two things I'm going to say. So one is, I'm a clinician at heart, so I look after patients, and I really enjoy that. That is like my first and best job, and I chose to do general practice because I really enjoy the variety in that. So what I would like to see is, if there are clinicians or health professionals, listening to this or perhaps come across this podcast, to try and actually have that understanding, and perhaps if they have the opportunity to get involved, to make a change, then enable that change factor as well. That's one. The second part of this would be to try and see how, digital health and the movement of digital health, the impact of digital health on, community and people in real lives can actually have an influence in the way their health outcomes are. So I think there's a twofold here. There's many industries that can be involved in this space. Yeah. I think there's a lot of opportunities with that.
Yeah, amazing. Lastly, any other final takeaways from here at HIC in Melbourne, or things that you hope that perhaps attendees would bring back to their health systems or to the technology they're creating that you've noticed?
I think there's a lot to take in here. Sometimes it can be really overwhelming with the changes that are coming in. But health in itself, community and patients are becoming more and more knowledgeable, and information is becoming more and more accessible. Now, with that, we also have to consider privacy factors. With that, we have to consider issues with breaches, confidentiality. I think there's a lot to take away from it as a health professional and as a consumer. So I think the key is it's coming. It's probably already come, so we better catch up with it and probably try and be ahead of that tide so that we can actually enable the consumers, doesn't matter who it is, to be well informed and better informed.
Hi Pete, good to see you again. Andrew Aho is my name. I'm from InterSystems, and at InterSystems I look after the data platforms business across Australia and New Zealand.
Great to chat again, Andrew. Always a pleasure. Regular at HIC as well. What brings you this time around?
Definitely a regular at HIC. We love this event. Always a feature in the calendar, and big supporters of AIDH. So I think we've been partners with them for the better part of 20 years, and certainly many of our staff are accredited by them and part of the program. So yeah, great to get out. Kind of a big event for us each year.
And something to, obviously attendees would be familiar with the InterSystems name, and many in the know when working with you would be well across the work that gets done, but maybe at a higher level too for those coming across the name but keen to understand where you fit in with the whole healthcare ecosystem. Maybe you give a high level there, that'd be great too.
Yeah, sure. So, look, I think a lot of people do know about InterSystems, particularly within health. It's about 80% of our kind of day-to-day business, maybe a bit more depending on how you count it. But we're really behind the scenes a lot of the time. So people come to learn about us because they might be using Epic, and then they discover actually that's all based on InterSystems technology. Or large companies like Sonic Healthcare use InterSystems to build their applications and deploy their pathology solutions and services all around the world. We also go to market with a electronic medical record called IntelliCare, is the AI-driven release of what was previously known as TrackCare, and that's a very popular EMR, particularly here in Australia, Asia Pacific, and Europe. So those are kind of our two core things that people know us for. But in the US, actually, US, UK, and the Middle East, we've quite a big business in HIEs, their Health Information Exchange, right? So particularly in the US, that's a huge part of our business. It's called HealthShare. A kind of a little secret, I guess, is that everything at InterSystems is built on InterSystems. So the Iris data platform that I mentioned at the beginning, that Epic used, that's the same thing we use to build HealthShare and to build TrackCare and IntelliCare.
Love it. It's always great to get to different parts of the world, and it's almost like there's my little safe space of catching up at the InterSystems booth. I'd say booth, but at HIMSS it's like a village that's there. So
it really is.
Good amount of presence. So that's well across what's happening in the healthcare ecosystem. So always some interesting insights and reflections. You're up on a stage here at HIC talking about connected care, I believe. Tell me about more of that.
Connected care, yeah, absolutely. So I think it's a bit of a theme at the moment around Australia in particular, but everywhere. And it depends on who you speak to as to what connected care might mean. So I was speaking with a clinician yesterday, and we were talking about being able to get a full picture of the patient journey, no matter where that person is being seen or has been seen, being able to stitch it all together and see, what kind of care might they need moving forward, what conditions are we treating for here. For government and providers of hospital and healthcare services, it's about making sure that we have all of our services talking to each other to improve operations, efficiencies, reduce waste and things like that. For the clinician, really, they want to be able to have all of that information, as I said before. For the patient and the consumer, I think, many of us know somebody who's had a story where their data didn't follow them around or they found themselves repeating their information. So to me, connected care is really all of those pieces. Now, in the context of the Australian government, the Digital Health Agency, they're undertaking a program at the moment called Health Connect Australia, which is all about delivering Australia's health information exchange so that we can get to kind of some of those things that I just talked about. And that's a lot more than just technology. That's, all about the people, education, legislation, incentives, all of those sorts of bits and pieces that go in around policy and funding to be able to make that happen. So it's a great topic, and certainly something that InterSystems is a big part of.
Yeah. Yeah, it's well within the wheelhouse for sure, and so it'll be interesting to watch how that develops. Lastly, what are you hoping that attendees who swing by the InterSystems booth or catch your session up on a stage either take away from the session or reconnect back with the team to talk about?
Yeah. Look, I think something that's been central to my career is helping people get value out of data. And certainly at InterSystems, that's what I get to do each and every day. So at my session, really, I was talking about getting value out of data in a connected care setting. And we've got some great examples here in Australia with WA Health, South Australia Health, Northern Territory Government, who are doing this today and really moving a lot of data around the system and accomplishing that already today. So if people do come past our booth here at HIC, we have on display the brand new IntelliCare electronic medical record. It's all AI-driven, AI-capable, so it's got some incredible capabilities. I mean, you can walk around and find a few scribes here, I'm sure. They seem to be the topic du jour. But we've taken that, in fact, we've had it in the product for a couple of years now, and taken that to a whole other level where it's really helping the clinician improve the experience with, taking the next steps to be able to automate what would be otherwise manual and tedious steps. We're not automating to the point where we're taking over because we believe in the human in the loop, but certainly this is a very forward-thinking and impressive set of things we put together. So I'd encourage people to come by and have a look at IntelliCare as well.
So Farhoud Salimi, I'm the Chief Technology Officer at Telstra Health. So I've been there for about 3 years, coming up to 3 years, and prior to that I was at eHealth New South Wales for about 16 years. So I've been in the health sector for a fair while now.
Super cool. And there are episodes back in the feed that people can go and check out, and a bit of a long form dive into some stuff that we've talked about on the podcast. But it's been a bit since we've looked at all the moving parts of Telstra Health. Where has the key focus been of late?
Thanks for that. Yeah, it was a while ago since we spoke about interoperability, I think, was the last time. So we've been busy at Telstra Health. Look, our vision is still around how we solve for that connected health challenge that everyone's talked about over the last day today here, and we're still very focused on that. So over the last 3-4 months, we've actually launched our new strategy to take us out to 2030. Really 3 key themes through that. So simplification is number one, how we simplify our business, how we interact with customers a lot more effectively and efficiently to be able to get better service back to our customers across the ecosystem. Secondly is our modernisation journey, which I'd like to touch on a bit more as we go. And that's really, really exciting because we're not only modernising some of our current classic products, but also have a vision for the future over the next 3 to 5 years of what we're going to do in that space. And finally, obviously, data and AI. Who's not investing in insights and data nowadays in the healthcare industry? So that's what we've been busy doing.
Yeah, I want to come to the modernisation bit in a tick, but I often think, Telstra Health, you've got a technology capability across broad range of stuff in healthcare, but I feel like still being able to then integrate with the rest of the ecosystem and have those key partners in, strategic areas is going to be super important too. I assume like partnerships also play a role in the whole process too?
Definitely. Look, we can't do this ourselves, Peter. It's such a big industry with a lot of people in that space, whether it's technology partners that we work with or other partners within the ecosystem, providers, governments, both state and federal that we need to work with. So really, really important to make sure that we leverage the partners that are in the ecosystem to make sure that we can accelerate what we need to in the market.
And tell me more about the modernisation side of things in where you're looking at and that kind of forward-facing lens that Telstra has at the moment.
So it's in two parts, I think, for us. Firstly, it's about our current products. So whether you like to call them classic products or our current product sets that we have in the market and had in the market for the last 20, 30, some even longer. Obviously, Telstra Health has had them for about 11 years now. So we're really investing in those over the next 3 to 5 years. We've got a committed expenditure that's set aside to actually modernise all those products, whether it's capability uplift around cybersecurity, whether it's integration and interoperability or compliance work that we need to do in the sector, but also delivering, obviously, features for customers as well. Yeah. So that's our current product set. But I'm really excited to also talk about what we're doing in the next 3 to 5 years around modernising our platform. So we selected a partner to work with. I think at DHF I announced that we're partnered with Salesforce on that, and we're using the Health Cloud platform to modernise our entire product suite onto the Health Cloud environment. So over the next 3 to 4 years, you'll see us release new products on that platform. So our population health screening platform is the first one, then our multidisciplinary care products, so primary, community and specialty will be released on that platform. And finally, our aged care solution set will also be on there. And this is about bringing an integrated, interoperable solution on the same data model with the patient at the centre. So we're really redesigning our ecosystem with a patient at the centre with connectivity all the way through the different, sectors.
Yeah, interesting. And connecting all those bits means then we'll have a lot of data, and data is kind of a hot topic at the moment, and there's a lot of things we can do with that data. I'd love to hear your kind of take on, I guess, your forward-facing piece on the role that you see in connected technologies playing with data, and I'm sure there's a role that artificial intelligence will play. Where's your head at with that?
And we heard a fair bit about that this morning in the keynote, and I think to get the ability to be able to interact with that data set, I think you need a set of standards and some harmonisation of that data. And obviously within our current platform, we are looking at modernising, as I mentioned, in the current products, modernising that to be more interoperable with mapping to fire standards, with the work with the Sparked Accelerator and the department doing there. So we are looking at modernising there for fire. Our new platform is going to be on the same data model across all the different sectors, like I said. So that enables us to then be able to extract all that data set out and be actually able to report on it, be able to drive insights back into the ecosystem. And with that, we've actually also started investment on a unified data platform. So we're going to be bringing all the data from all of our products into a central repository and then really interjecting that back in within the workflow of the clinician to be able to give them insights as they work today within the current product set, and obviously trying to pull some of that data set together in a bigger ecosystems like our statewide or federal platforms to provide some insights back into the policymakers in terms of where they can make the right decisions and right investments. So I do think there's a fair role to play in solving, obviously, the challenges we have with healthcare in the next 5-6 years with data. But also, look, even as at now, we're providing some AI models back into our products. Some of our classic products have now got scribe technology that are helping clinicians take notes. There is obviously always a clinician in the middle of that to make sure the right scribe or right dialogue is being captured and make sure it's accurate. But we're certainly investing in some of those technologies in our products. Also around the Deteriorating Resident Index, it's a mouthful, DRI. We're also looking at doing some work with that in the aged care sector as well to help with predicting, obviously, deterioration.
We hope you enjoyed this episode of Talking Health Tech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.